So, good day everyone. My name is Nonito Serrano. I am from Double Doctors College from the Benson 11G from the Global 20. So, today I will be performing the complete bed bath. So, bed bath means to wash someone who is in bed, and it is important because it cleans the skin and helps the skin to be free from the infection. Also, it helps to relax the patient and allows hair to feel better. So, I had already performed the hand washing to protect my patient and myself from infection and cross-contamination. I closed the door, fixed the curtains, adjusted the room temperature, and provided adequate lighting to ensure my patient comfort and secure my patient's privacy to protect from chills during bath. So, what I'm going to do now is to introduce myself to my patient. So, verify my patient identity using my identifiers to ensure that I am doing the right procedure for the right patient. Of course, I must explain to the patient the procedure I will do. So, good day, ma'am. Can you give me your full name?
I am Serrano.
Always. So, when is your birthday?
October 8, 2003.
Alright. So, thank you, ma'am. So, and today I am doing a complete bed bath, which means that I am going to wash your body and remove the dirt and oils or perspiration in your skin, and of course, for you to feel refreshed. Will that be alright?
Sure.
Alright. So, okay. So this time. So this time I begin now. Would you like to boil at this time?
No.
Alright, so ma'am, I am going to do my gloves. So now I have prepared the necessary equipment. So first thing I have here is my water basin. And secondly, I have deodorant. And next will be my moisturizer lotion, but this is optional. And second, thirdly, I have alcohol. Hair comb. And blanket. And so in the hospital settings, naturally I have to raise the bed to a comfortable working height and lower the side. So after doing that, I have to assist the patient moving closer my side of the bed. So ma'am, I need you move a little. Alright. So after that, I must do a bath blanket over my patient. So, ma'am, can you... So, ma'am, can you remove the... And now, I need to remove the patient gown. So, I am going to... So, ma'am, I am going to remove your patient gown. So, ma'am. So if the patient has an intravenous line, injuries, or reduced mobility at the side, I should store at the unaffected side. So please, so ma'am, can you place your hand? So after removing the patient gown, I now I now have wash basin with warm water. It's about 2/3 full out, 33 Celsius to 36 Celsius. So ma'am, can you insert the water? Ito gawin mo. Thank you. After that, I must drape a bath blanket over my patient. So, ma'am, can you hold this portion, ma'am? And now I will remove the patient. And now I need to remove my patient gown. So I am going to remove. So ma'am, I am going to remove your patient gown. So after removing the patient gown, now I have a wash basin with warm water. It's about 2/3 full at 30 Celsius to 46 Celsius. Now can you take the water if the hot or cold? So how do you feel it now?
This.
So the next thing I will do is to remove the pillow under my patient head and raise the head to 30 to 45 degrees. And place a bath towel under the. So let's start washing the patient face and ask if they want to use soap and wash their face, since some patients may not use soap of their face. So and place a bath towel under the patient's head and over his chest. So, and now I need to dry her arm. And next I will put the jadon peroxide. Alright. And after that, the next it will be the left hand. And next, okay. Alright, and by her arms. And I will put this gentleman Alright. So now I am going to proceed the bath my patient cheese, and what I'm gonna have to do is drip over a bath towel over the cheese or accuse the cheese while I lower down and back blanket above her cheese. Alright. You can just like it. One, and what I gonna to have to do is a drip over a bath towel over a cheese or accuse her cheese while lower down the blanket above his umbilicals. Using a bath net, start cleaning the patient cheese, and of course, special attention to the skin folds because this area are very prone to sweating or perspiration, and as well no bacteria will drive includes moss area dry to patient cheese. Alright. And next I will dry. So then I'm going to check for the water and change it if necessary. Alright. So okay, now I'm going to proceed at his abdomen, and I'm going to drip another bath towel over his abdomen, lowering or moving the back blanket downwards to his pubic region. So I'm gonna start washing my patient abdomen. So in washing my patient abdomen, I am going to keep it covered with its back up blanket and pay attention to the umbilicus and surrounding skin fold right the abdomen gently and slowly. So now I am done with my patient. Alright. Now I'm going to start the washing my patient leg. Okay, so using this firm soap, I'm going to start to wash my patient legs starting from the ankles to the knee, and from the knee to the leg assist for the skin with this swelling, blister or pain. And after that, I will dry her legs. Alright. And okay, you got your other hands. And after that, I will dry her legs again. So now I'm done with my patient anterior side of the body. I am now going to discard the wash cloths and remove privacy and prevent chills. Then I'm going to refill my wash basin with clean warm water, and the gloves that I have used will be going to replace with a new fresh ones. So since now I'm done a new clean set of gloves and I have refilled my wash basin with warm water, I'm now going to assist my patient up to a from side lying position so that I can clean his back. So, ma'am, would you like to? So, ma'am, can you do this one? And I will put the towel. And I will clean her back. So if the patient's skin is intact, then discard the gloves if the patient like to have a back massage. So ma'am, do you want to massage your back?
No.
Alright, so okay, so now that I'm done beating my patient, so ma'am, can you go back to your seat? Alright. And I like to go back, I will out this towel and I will go back there. Alright. So, I'm going to have to wear it. I am going to check for the devices attached to the patient if present. So, okay now, so have the patient with his grooming by combining your hair. Now I'm done with your bath. So ma'am, how are you feeling right now?
I'm good.
Alright. So that is very nice to hear. So since we were done, I'm going to head out now and let you have some rest. So okay, if you need anything that hesitate, call me. So just call me. I'm now going to proceed the aftercare of equipment that I have used in order maintain cleanliness and orderliness. Equipment may serve as reservoir for microorganisms, and aftercare will prevent further spread of infection. And after that, I am going to perform the hand hygiene to deter the spread of microorganisms. And I am going to provide documentation and reports on what I am done with you during the procedure. So that's all of our interview. Thank you, ma'am.